Good evening and welcome to episode 47 of the Detroit Metro Plug podcast, where connections matter, bringing you interviews of Detroit difference makers in the area of entrepreneurship and community involvement. I got to turn my phone off right, so we don't have any distractions. So welcome to the Detroit Metro Plug podcast, where connections matter, bringing you interviews of Detroit difference makers in the area of entrepreneurship and involvement. Thank you for those who are joining us live on Facebook, live on LinkedIn, and live on YouTube. Thank you. And happy Sunday to everyone. We are in the midst of fall in Detroit, Michigan. It's getting dark, 7:45. The leaves are changing colors that fall on the ground. We had a chilly day today, a little bit of rain, a little bit of chill. But I like this time of the year. The cider meals are popping. The hot apple cider, those delicious donuts that I probably shouldn't be eating, but I love them anyway. But just welcome. Do me a favor. If you're watching this live, I want to encourage you to like and follow and share this broadcast with your friends and family and associates. If you watching this tonight, if you find value, we have a special guest who's going to be sharing about community awareness in her business and her journey with her organization. So I'm excited about that. Please share your comments. We can share some of the comments while we're broadcasting. So share your comments. So thanks again. So let me get into our guests for tonight. Let me put this slide up here. So our next guest. She is a founder of and CEO of a great company that's providing great services to our seniors in the Detroit area called Granny's Helpers LLC. And she has a background in nursing. She's in nursing school to become a nurse. She's been serving and helping people throughout the years in Detroit. She has a family, and she's been exposed to a lot of community programs, and so she's going to talk a little bit about that, her journey, and a little bit about her business. And I'm excited. We're about celebrating people. When we bring people on this show, we celebrate what they're doing. We bring awareness about what's going on in Detroit. These are difference makers that you may not hear about on the news. Well, on our podcast and our platform, we highlight and celebrate what's going on in Detroit in the area of community involvement, community leaders, business owners. And so, ladies and gentlemen, I'm excited about our next guest. Please let us welcome LaKesha Green.
Hello, how are you?
I'm good. How you doing?
I'm doing good.
I'm doing
I'm
good.
blessed.
Okay. All right. So, before we go into our questions about what you do, we always start off by allowing you to tell us a little bit about yourself, where you're from, who you with, east side, west side, all that good stuff. So, tell us a little about yourself.
Okay, I'm from the West Side, Detroit, born and raised. Um, I started off in healthcare as a medical biller and coder. I did that for 5+ years, and then I started over into being a CNA. I went to Baker, got graduated from the program, the senior program, and became a certified nursing assistant. And I did that for 6+ years. And I've been working now in that career. And I started my business because of it, Granny's Helpers in 2021, May of 2021. And I'm currently right now in school to become a registered nurse. I did go to Baker for my bachelor in health science. My minor's in human resource management. And working and going to school, I noticed that our community was lacking the attended care that it needed. And so that prompted me to move back to Detroit and start my business in helping the community. As well as my family. So that's a little bit about myself. I'm a single mom. I'm divorced, single mom of 3. And that's about enough, I think.
All right. Thank you for that great introduction. I
Oh,
got to you
thank you.
represent the West Side. I got to get that
West
out. The
side,
West
west
Side.
side. I've lived east side though. I've lived on the east side as well.
Okay.
Macomb.
Okay, good. So you're all over Detroit. That's great. We got a few comments. People are watching. I don't know. This is your proud daughter.
Oh yeah, it's my daughter. I have a 21
Okay.
year
And
old.
there's is that Sheila Perry? You this is
Yeah,
your
that's
mother?
my mom. They represent the night. Oh,
All
the west
right.
side coming on through.
Is it Dolores
My
Dukes is watching?
granny, yeah, that's her company's named after her. Granny's helper.
All right, okay. And then we have Sheila. Do you know this person? No?
Monique. Yes, yes.
Okay. All
That's an
right.
aunt of mine.
Okay. All right. All right. All right. So
Also a
okay, so
Christian.
let's get into it. You shared a little bit about yourself. So what you're in nursing school right now, right?
Yes, I'm in nursing
So
school
what
right now.
was your journey to get into wanting to go into nursing? Let's
Well,
start there.
okay. So I really wanted to be a police officer. I really wanted to be a police officer. I passed the test with a B plus, and I was going into the police academy. And my grandmother and the family was very adamant of, it's too dangerous. You're a mother of three. We don't want you doing that. They're really adamant about it. And so what I end up doing is completing the program for medical biller and coder. So instead of me going into the academy, I started a job doing, it was a Medicaid eligibility hub at the time, which we qualified patients that came into the hospital that were uninsured. Um, we qualified them for Medicaid or Medicare, filled out the app, did the case management work, got them approved, and then went into the hospital host and billed for them. At the time, they were known as Creative Healthcare Company. They started off as Care Compensation, which was a Medicaid eligibility hub. Now they're Creative,
Okay.
which they ventured off into R1. So I still have close connections with some of the workers, field leads, and
Okay.
team leads.
So you started out in your sound is going in and out. I'm not sure what's going on, but can you hear me good?
Yeah, I can hear you.
Okay, so you started out in medical billing.
Yeah, I started off in medical billing.
Okay, okay, and now you ventured into
Yeah,
to
and then
nursing.
I started off as a follow-up rep, went over
Okay,
to a disability analyst,
okay,
went from there into a team lead, and
okay,
then that's when I ventured over, went back to school for a certified nursing assistant, and I've
okay,
been doing that since 2015, I believe.
okay. And what area you like to focus on in your in providing care?
So our company focuses on the attendant care needs of elderly, disabled, and disadvantaged residents of the state of Michigan. Now we're
Mhm.
national providers for the um, state of Michigan, but we're federal providers for the actual state, which is all 50 states. So you can apply to become a Granny's helper in any 50 states and provide those care needs, whether it's a home health aide, CNA, RN, LPN, nurse
Mhm.
practitioner, or case manager.
So give us.
So,
So if you don't mind, I just want to backtrack to kind of to give you a chance to share your story, your journey. What was the birth of this business? What motivated you to do this?
well, I was working in as a CNA for 5 years, coming up my 6th year. I wanted to, my company was changing. I used to work for Centria Healthcare, which they specialize in some of the cases where you would see State Farm cases where some of the clients were in car accidents, and then
Mhm.
we provided the care needs for those patients that were injured in a car accident, whether it was State Farm, Allstate, some of the major insurance companies. Well, Centria started, they decided to go full ABA, which that's working with children with autism. And I am an ABA behavior technician. I did get take my classes and get certified in that. And I did that for 2 months. And I
Okay.
realized that I really had a calling for, the attendant care side, which is focusing more on the patient. I've worked with quadriplegic, paraplegic, amputees, TBIs, which is traumatic brain injuries, behavior, we call them behaviors now. Before it used to be mental illness, but they got into a clause where now it's behavior issues or behavior management. It's a more, I'll say, sensitive terminology for it, for the patient and the situation that they're in. And I've worked with all of them, and in working with them, I've worked all over the state of Michigan.
Okay.
And seeing that, I've seen the need in Detroit within that area
Right.
that
Right.
some of our residents weren't, they weren't well, I'm sorry, excuse me. They weren't paying for the attendant care that the Detroit residents need. Like some insurance companies only pay a cap, which is, it can range from 16 to the highest being $19 an hour for the attendant care for probably 4 to 8 hours, when you have residents that are in need for either 12 or 24, which is around the clock care. But because the insurances are only paying for a set rate on a set hour, some of those residents fall by the wayside. And during the pandemic, we had 75% of our elderly residents that were neglected and end up dying in their homes from,
Wow.
not receiving the attendant care needs that they needed, which was, you know, nutritional needs, daily
Right.
activity needs. Like, it was some were not aware of their cases being as severe and staying at home, falling asleep and not waking up. Um, I did send you a clip. On that clip, it gives you the statistics on within the state on, the 3 out of 5 residents, which were elderly, disabled, or disadvantaged, were fell by the wayside during the pandemic, which
Wow. Wow. Wow.
stats was kind of high. So, in seeing that and knowing, seeing it hands on and knowing um, what was needed, that prompted me to open up my business.
Wow.
So,
So this started during the pandemic, or in the midst of it, or when did
May 21st, May 2021, May
2020?
18th, 2021 is when I
Okay.
started Granny's Helpers.
Okay.
Yeah.
Okay. Now I have a slide I wanted to show. Let me see here of your company. So Granny's Helpers LLC, National Providers of Care, and so this is I got this from your website. So how would you just basically define what you guys do and the services you provide?
Okay. So what we do is we can do adult care, activities of daily living, which are grocery shopping, errands, adult care needs, which we're coming into the house and giving that activities of daily living, which were either grooming, washing, home maintenance, minor home maintenance for residents that are, needing assistance. We also do to and for doctor's appointments to and from,
Mhm.
pick up and take, or go, with them just as that compassion care that they need. We offer that. And my website, it has basic, standard, and premium. It's a package that are more geared to low income and subsidized residents, where they can subscribe to a monthly set rate, where someone is constantly in and out the house, making sure that everything is um, up to par with the client, making sure that their needs are being met, that they're being, we're receiving healthy foods and nutritional diets, and, for our more disabled, which goes to, quadriplegic, paraplegic, amputees, assisting them because they constantly need help,
Okay.
especially during the winter time. Who's shoveling the snow? Who's taking them to their doctor's appointment? Who's, just checking in, making sure they're okay on the cold days.
Yeah.
And then we also offer those adult care, which, right now we have a high rate of dementia patients and residents. And you have so many sons and daughters trying to take care of their parents, and they're needing a break. We'll come in and sit with that, whether it's 4, 8,
Okay.
12, or 24 hours. Sometimes I've had calls like, well, I need somebody just to sit with my mom where I go on vacation for 3 days. We provide that at a set rate as well. So it depends. It's a case by case package that we go over. We do residential inspections to make sure that it's a safe environment for our helpers to go out and, service the resident that's in need. But we do anything that a home health aide, CNA, LPN, RN, or
Okay.
case manager would do.
And this
And
is
they
all,
certify.
and these services are all provided in the home. Is that correct?
Yes, we do private duty care, which means all residential.
Private
If you
duty.
live in an apartment complex, we'll help you out as well. But we are geared towards the more residential areas.
Residential private duty. Now, do they have to have some type of insurance like Medicaid, Medicare, or is it out of pocket? How does that normally work?
They don't have to have insurance. We take insurance. We take uninsured and insured patients. So if you have insurance, we do bill. We have a EHR system, which is a electronic health record system that is geared towards. It's called Dr. Chrono, and it's geared towards talking and being communicative with the doctor, the primary care physician, with that client. We can note take, record, fulfill prescriptions back and forth with the doctor, making sure it's an open dialect and that everybody on the care team knows and have the knowledge of what's going on with that resident and inside that resident's home. And it's all HIPAA guideline
Okay.
and secured.
So for those who are watching live and watch the replay and they want to take advantage of your services, I have a slide that has a phone number. What's the best way for them to get in touch with you?
That number there, you can call it the 313-327 6102. That's the office line. But you can also go to the website, which is www.grannieshelpersllc.com. It'll tell you the different packages that we offer. It'll tell you it's some reviews on there, and you can fill out the information at the bottom. You can go on our website and look at our websites, um, and look to just see the open dialect that we share. And you can
Okay.
fill out the information, and that will go straight to me. It'll go
Okay.
straight to our email address, and someone will get back with you within a 24-hour
Okay.
timeline given.
So they have the phone number, the website, and the email. That's the way they can get in touch with you.
Yeah, that's correct.
Okay. Now, I want to go into some other things. So what do you enjoy most about what you do?
I enjoy helping. I enjoy helping. Um, my family's online. They could tell you, I help out with my grandmother's friends that I've helped with their parents and and grandparents. I think my purpose in life is to serve the community, which that's why probably I chose healthcare, or
Yeah.
my first love was police officer. But I fell into the role of a healthcare provider. So that I think it's my God-given talent to have the empathy for the patient to assist in their care, in
Okay.
their daily needs.
Now, I know that you're aware there's other organizations that provide at-home services, home health care, and private duty care. What would you say separates you and
What
your and Granny
separates
Helpers? Yeah.
Yeah, what separates us is we offer residential assistance. So those providers would be more so guaranteed through a HMO or PPO. And this year, they changed the Civil Rights Act and amended the 14th Amendment that everyone with HMOs or PPOs have the right to choose. Before, like Blue Cross Blue Shield would say, you have to be in our network, and we only provide so many hours for our patients that pay our co-pays and pay our insurances monthly, and it gets taken out of
Mhm.
your checks at your jobs. Well, because they revitalized the 14th Amendment, you have the right to choose on the public welfare that's being serviced to you through whatever service provider. So what makes us different is now you get to choose us more so than someone in Blue Cross Network or Blue Care Network or Total Care Network, but we still accept those insurances. We work with low income and subsidized income, which those are Medicaid recipients, which Medicaid pays at a set rate, $15 to $16 an hour. And that's what Burger King and McDonald's is paying their workers. And for a certified nurse assistant that is qualified to do some of the daily activities or some of the care of some of the nurses, they're trusted with that patient or that resident, for per se. I mean, that's a more sacred, a more private service you would want, where you want someone certified and professional to do it, but you want that standard care and that quality of care provided as well. And that's what we provide, standard and quality. It's not one or the other. We offer them both. We're professional and we're certified, and we're through the state. So we're federal, we're stated, and we're community based.
Awesome,
Hello?
awesome. I'm here. Yeah, awesome, awesome. Um, that's great. So there may be people watching who are inspired to do something that you're doing. You know, somebody who's a CNA or a nurse, or what would be the steps that they would go through? What advice would you give them if they wanted to do something similar to what you're doing?
Well, they can come on, they can sign on up. We're hiring. We are hiring. You want to do what I do? We are hiring. We do background checks and fingerprints, though, and we're going through partner with Intego, which helps us with that to do all our screening. But
Okay.
what I can say, as me as a service provider, what makes me different from everyone else is that all our employees are salary employees. We don't do hourly here. And I
Mm.
feel like society has paused on giving the average worker or laborer the funds necessary for their needs. I don't think any senior should be paid $16 an hour, $17 an hour, because the work that we do is sometimes we're there 12-hour shifts, maybe 12 to 24-hour shifts, servicing a individual
Right.
that, $16, $17 an hour, that's burger. We're not standing flipping burgers. We're there for the emotional needs,
Right, right,
the
right,
spiritual needs, the physical
right.
need for
Yeah.
all residents, the empathy that goes into the job and the professionalism on getting the job done and not being fair with the resident, being fair and treating them as though how they should be. They should be
Right,
respected, not because
right,
they're disabled or elderly or disadvantaged that you should, skip
right.
steps. That's not how we work. They're
Okay.
respected, their voices are heard,
Right.
and I think we're walking into a new economy with them changing the 14th Amendment, that they realize that
Okay.
some disadvantaged or disabled residents or people per se, they have a voice. Just because they're disabled
Right.
and elderly, just because they're disabled or they're disadvantaged or elderly does not mean that their voices is unheard or
Yeah.
should be slighted. And the way I started my business is taking that into account, that this person has a right to say whether they want this or want that, but we make sure that we exercise in explaining why this is being needed, why this is being done, and how it benefits you. It's
Okay.
some people, they feel like, I'm just gonna give you a bath, and it's like, well, she don't take a bath right now, but it's all about communication. It's all about communication and
I want to.
respecting
I
one
want
another.
to. There's been some comments as we've been doing this interview from Facebook. There's a Dolores Dukes. She said that you helped her. Do you know? Want to comment about
Yeah,
that?
yeah, that's my granny.
Oh, okay.
That's my granny, and I do have, yeah,
Okay,
yeah.
okay. And then
They were,
there's a Brian Tipton says from YouTube says love it, love it, love it. All right.
oh,
So just wanted to
okay.
bring some
Thank
of the
you.
yes, some of the comments in. All right. So what advice would you give someone who's starting a business like yours?
So, I feel like we should network. I think we should network, and with us working, we're black owned, black woman owned, Detroit based. I think that if we correlate and collab, I think we can really make be a movement within the city.
Okay.
I see so many. I live, on the west side, in Detroit. And I see so many wheelchairs in the wintertime stuck in the snow, scooting, trying to get to the store. And I'm like, if we all, it says it takes a village to raise a child, and I feel like when the village stops caring, then we leave some by the wayside to try to fend for themselves. And I
Mhm.
think that we should work together. So someone doing the same thing I do, let's collab, let's correlate together and come up with some plans to help our city out, because our city is in need.
Was there any changes you had to make due to COVID-19?
No, by us being healthcare care professionals, we always PPP. We always sanitary. You always cleanly. And I'm a God fearing woman. I'm saved, baptized, and full of the Holy Ghost. So we grew up on the next thing to cleanliness is the next thing to godliness, and so we keep it clean over here.
There's a comment from Sonia Hubbard. She says, "Granny's helpers is the difference that is making the difference in our community."
Oh, thank you for that.
Yes, yes. Um, so what do you see as the coming trends in your business?
I think the coming trends are, people just helping and assisting one another.
Okay.
For a minute we got scared through the pandemic, and I think it brought our community closer. because you start to see, and I worked in the hospital during the pandemic, and I've seen a lot of death. I've seen
Yeah.
a lot of deaths, and I've seen a lot of deaths within my same skin color. And it changed me. It changed me to want to help every person that I see, not just my skin color, but in someone in need. It's like, you see someone pushing a basket at the grocery store that's elderly, and sometimes you taking that basket and pushing it up and taking it back for that elderly person, it means a lot, because it's a lot of strength trying to push that basket as you get older, and pull it, you know. And I know sometimes, with them being, with, what is it, violence being high and robberies, they're not as trustworthy as they used to be. And remember, we used to have security at the grocery stores. Now it's just lights and cameras, but having someone there makes a difference.
Yeah.
It's because it's knowing that, and I have my back, but in case someone is there, something happens, someone's there. You know.
Okay. That's awesome. We're going to go into more of some other services you provide and any announcements that you may have. We're going to take a quick break and we'll be right back.
All right.
Hey everyone, this is Charles with Detroit Metro Plug Podcast. If you are finding value in today's video, I invite you to subscribe, like, and comment. We would love to hear your feedback. And don't forget to click on that notification bell so you can be notified when we have upcoming episodes of difference makers in the area of entrepreneurship and community involvement. If you're interested in being a part of our Facebook networking community, I invite you to click on the link to be a part of that community. This is a place where you can network with like minded people and a chance to share about your product or service. If you're interested in working with me directly on how you can share your story with video or with podcasting, you can email me direct at DetroitMetroPlug313@gmail.com. Thanks again, and let's get back to this interview.
All right, welcome back. For those who have been watching, thank you. For those who are just joining us, we're back here with LaKesha Green. She's founder and CEO of Granny's Helpers. She was sharing about her journey, her background growing up on the west side of Detroit, and her background working in medical billing and working as a certified CNA, and just working with the elderly and those who are in need, and seeing all the things that happened during the pandemic. We experienced a lot of death. There's people who are alone, who wasn't thriving and was affected by this pandemic. And she was motivated to start a company called Granny's Helpers, and she's been sharing about the services they provide with private duty, home help, taking people to the grocery store, taking them to doctor's appointments, just sitting, keeping people company, making sure they have meals, personal care. So she was sharing all about that. And so we're going to get into, she shared about how you can get in contact with her. Um, we'll have in the description and the playback the website, the phone number, and email. And could you mind sharing your phone number, email, and website again for those who just joined us?
Okay, guys, my phone number is 313-327-6102. Our website is www.grannieshelpersllc.com. And my email address is grannieshelpers1@gmail.com. If you go on the website, everything's there. You can fill out your name. You can read on our services. You can email, read, fill out the information, and hit submit, and it'll come directly to my phone. And I'll be in touch with you probably within the next business day.
Now, what's been the best way you've been able to promote your business and what you're doing?
The best way in promoting is getting out there and speaking to different individuals, passing out my card, and just I think the word of mouth. I think with being based out of Detroit, Detroiters they want to see you, they want to hear what you're talking about, and they want to look you in your eyes to make sure that you telling the truth. So
Okay.
that's been pretty well. I
Just
think,
being out in the community. Okay.
yeah, just this last weekend, I was at one of the community activists for Peace Day. They did a balloon release. I was there talking to some people, and I think what is this? Just Saturday, we were out
Mhm.
giving out food at the Temple 5, which they give out food for the elderly, fruit and
Okay.
vegetables
Right.
on every other third Tuesday.
Right.
Yeah.
Okay.
So just
That's
making
awesome.
sure, yeah,
You have
making
any
sure.
you have any you have any announcements or upcoming events or anything you want to share with our audience?
What I want to share is you guys just make sure you spread the word and go on the website, visit the website. You can reach us at Granny's Helpers one at Facebook, Granny's Helpers LLC on Instagram. We're
Mhm.
on LinkedIn and Twitter. So just make sure you reach out and just stay tuned to for more to come.
Okay. And as we wrap up, what would you say is the one word or phrase that best describe how you do business with Granny's Helpers?
Quality care is right there in the right on the shirt and right on the post. National Providers Quality Care.
Quality
It's
care.
right
Quality
there,
care.
quality care.
All right. So I want to thank you for being on this podcast and sharing about Granny's Helpers and what you're doing in the community. And you're doing important work taking care and looking after our seniors. I definitely appreciate you and want
Well,
to say thank you for your service.
thank you for having me. Thank you for shedding a light on some of us African American women that's out here making a change and shooting moves to
Yeah.
make our community better. So I thank you for having me here.
Yes. Yes. Thank you. Thanks again. And we just appreciate you. And so, folks who are watching this live and those who have watched this on the replay on Facebook, on YouTube, we want to spread the word about Granny's Helpers. This organization is here to support our seniors, those who are having life challenges, those who are alone, who need support services. Um, now, this stuff is not free. So there is if you have Medicaid or Medicare or insurances or some type of insurance, um, there is a possibility where that can be billed. Also, there's also private pay as well. But these are some important services helping our seniors. So check out their website, uh, the company email, and then we'll have the information in the description and the replay for those who will be watching on YouTube. So that concludes our podcast for tonight. I want to wish everyone a blessed week. Thank you for tuning in. And again, if you find value in what we're doing, we're about celebrating people, allowing Detroit difference makers to share their story about what they're doing in the community. We're about positivity. We're about celebrating. We're about providing information that will empower you, inspire you. So if you find value in that, hit like and subscribe. Definitely like your comments. And I'll see you again next week with another guest, Detroit difference maker. I'm excited about our next guest because on next Sunday, we have a guest. She's started a cookie company, and she went from living in her car to starting a business, and so she's going to share her story. So tune in next week. Thanks again, and that wraps it up. So.